Hello, I'm Esme Fuller Thompson. I'm the director of the Institute for Life Course and Aging at the University of Toronto. And as part of our COVID-19 talks, today we're going to talk about anxiety in the context of the pandemic. I'm really delighted to be able to speak today with Dr. Irina Nica-Graham. She is a geriatric psychiatrist at Mount Sinai Hospital in Toronto and an assistant professor in psychiatry at the University of Toronto. Thank you so much for joining us today.
Thank you for inviting me. It's a pleasure to be here.
Great. Today, what I really wanted to talk about was anxiety in the context of the pandemic. Can you tell us a little bit about that issue?
Sure. So anxiety is a response to threat. It's a very normal response to threat. And the pandemic hit us with a big threat, a threat to our life, a threat to our safety. And the response, the community response, the country's response to control this pandemic has also added layers of anxiety in terms of being socially isolated, financial stressors, being separated from family, losing some support, not being able to access healthcare as easily. So the threat, both from the virus and the changes in the normal life, in the life the way we know it, is going to very naturally cause a lot of anxiety in people. And the degree of response, the degree of anxiety is going to depend, of course, on the person and also on their circumstances and their vulnerabilities. And seniors are particularly vulnerable because the pandemic is creating more risk for them given their age and medical comorbidities, and all the media messages about how a significant proportion of people who are the most affected in terms of getting ill, dying from the virus are primarily within the older age population. So this can increase the anxiety quite significantly, and rightfully so.
Well, that's a perfect lead into my next question, which is, what are some helpful day-to-day strategies to cope with anxiety in the context of the pandemic?
Let's come back to what anxiety and fear is. So there's a threat, and we know what the threat is to some degree, but there's a lot of unknowns about the threat. People watch all the news all the time, and the news are about the threat everywhere, and some places it's pretty significant. So what's important here is to become more realistic and concrete about the threat to you as an individual. So to apply to your local context. So getting informed about what's the risk of the infection in your city, in your neighborhood, what are the public guidelines, public health guidelines as to how to protect yourself, what's the availability of medical care in your local area. So knowing this local information can help you actually reduce this big unknown and limit the threat. So that's one way. The other one is, so the anxiety comes with this big threat, and then you fear that the threat is overwhelming you and you cannot cope. So working on strengthening the ability to cope is important, and that can be done in multiple ways. If there are things that are in your control, focusing on those things and investing energy in those things can help give a sense of control in a situation that feels out of control. And if there are specific problems, like how am I going to get food because I cannot go out to the grocery store, or I have this medical problem in the office, I can't go to the doctor because the office is closed. So very specific problems that trigger anxiety, focusing on using the kind of problem-focused approach to that, and maybe enlisting help from others to solve these problems can actually help a lot to manage the anxiety. Often the bigger anxiety is a reflection of smaller anxieties about the everyday life where people feel stuck. Of course, cutting down on how much media they watch is so important. Establishing routines, so kind of establishing the sense of normal can help reduce anxiety. Connecting with others is so important. So it's harder to do in person, at least some phases of the pandemic, getting together physically has been challenging. So figuring out ways, becoming creative about how to connect with those around. And for seniors who are isolated, whose families are too far away, or they just don't have enough family and friends, figuring out ways who they can reach out to have that human connection, and that having the check-in, that they know someone is there thinking of them and knowing about them.
Well, that leads to the question. I, as a caregiver, an older adult who's suffering a lot of anxiety in the pandemic, what can I do? Certainly, you talked about connecting, so Zoom calls and things like that. But what else can I do, or another caregiver, to help?
It's been a very challenging time for caregivers because physically they were very restricted in terms of how much time they can spend to visit. So unless they live together, this has been a very painful time and difficult time. People have been creative about maintaining as much contact as possible. One thing for caregivers and family members to understand is that when one of their parents or other family members, when they're anxious, especially if the anxiety is high, trying to reason with them, it's not going to help, because the stronger the anxiety, the less availability of the thinking brain to work. So connecting more with the emotion, being reassuring, reminding them that you're here, you're going to help them through this, validating, yes, this is a very scary time. So this can help reduce the intensity of the anxiety. Offering advice without really collaborating with the person may not go far. So telling someone, well, why don't you go for a walk because it will help? Of course it will help, but it's not as easy as that. So helping the person find out what works for them to calm that anxiety, to feel better. So that could be one way to support them. And perhaps if they need help to set up those systems of self-soothing or comfort, to help them through that as well. If you're concerned that the anxiety is too severe, it's been lasting for too long, it really gets in the way of quality of life, encourage them and help them see a doctor, because perhaps there are other ways that can be done that can be quite helpful. Be mindful that if the person can mask their anxiety, so they say, oh, I don't want to go out because I'm too tired or I'm too old to do this. But if there's a change, if they're less involved, staying home more, more withdrawn, it could be that they're fearful of going out. They may have fears of falling or fear of getting an infection. And so don't take their words as the absolute truth. Challenge that a little bit, especially if there's a change from their normal way of coping and behaving.
In the case where anxiety is really exacerbated and really causing serious problems in day-to-day life, and perhaps it's an anxiety disorder that it's become, what kind of interventions are there from professionals like yourself or social workers or other professionals that you would recommend and or talk to us about? What kind of things are available?
So it's important to have this anxiety assessed in order to have a good understanding of the source and treat the source. Assuming that a regular medical checkup and workup has been done and there's an anxiety disorder, the classic treatments, especially if the anxiety is mild to moderate, is psychological intervention, so psychotherapy. If the symptoms are too severe to be able to really engage in psychotherapy, at that point medications would most likely be recommended. In terms of therapies, cognitive behavior therapy is the most research and has a lot of evidence base behind it. And some of the principles in cognitive behavior therapy is to help the person have as much exposure to the things that causes anxiety, and by doing this exposure, for them to learn to change the dysfunctional thoughts that they have, and also to change how their body reacts, so that fear response, in order then to be able to face this threat or stressor without feeling highly anxious. Other type of interventions are mindfulness-based, so mindfulness-based stress reduction or mindfulness-based cognitive therapy. The principle at play here is that through mindfulness, they learn to practice a non-judgmental observation of themselves. They become more self-reflective, and it really helps people become aware in the moment of what they're thinking, what they're feeling, and help them tolerate what they're feeling in a way then that allows to either learn strategies to feel better or learn strategies to challenge. So this would be in the cognitive therapy, to challenge the dysfunctional thoughts that feed the anxiety.
Are there any online resources that you would recommend for older adults themselves or for their caregivers around anxiety-related issues in the pandemic?
One of the websites that I found most helpful is Anxiety Canada, and they do have videos about speaking about the stress of COVID-19 and how to cope through this time and various related topics. But they also have an online therapy program that offers specific tools and specific therapy for different anxiety disorders, and it can be done at your own pace. And even just used in isolation, different tools can be quite useful. They have some apps as well that can help with the therapy. Ontario is now launched Bounce Back, which is a program that offers online treatment with some assistance from a counselor as well, so it can be guided for depression and anxiety disorders that are in the mild to moderate stage. So for people who are stable enough to do the therapy at home and benefit from doing it at home. There's a lot of resources in terms of getting support for seniors. So again, if you need help because you're isolated, if there's need for organizing meals or transportation, even calling 211 can get you linked to senior-specific services. There's a seniors distress line, there's seniors outreach teams, organizations like Wood Green or Sprint can offer help.
So you've done a nice overview of what's anxiety disorders, some interventions, things I as a caregiver can do, things that an older adult with an anxiety. It seems that it's a very hopeful situation, though. Even though it feels overwhelming, it seems that there's lots of options available. Is there anything else you think we should think of, Doctor, as we finish up? What else should people know about anxiety?
So anxiety is a normal response, which can sometimes get out of hand and it becomes an anxiety disorder. The good news is it's a treatable condition. There's effective therapies, there's medications that can help. So ask for help. Tell people you're anxious, ask for help, go to your family doctor, because the sooner you ask for help, the less you suffer.
Thank you for that. That's very helpful. We'll put the resources below this video. We'll put links to the Mount Sinai Hospital's educational brochure on anxiety and older adults. We'll also include these different resources in Ontario and beyond for older adults who have anxiety issues. So I think your take-home message was there are resources out there. This is a manageable problem, and the first step is to reach out to your family doctor or family and friends to start working on minimizing the anxiety in this context of the pandemic. So, is that a fair summary?
Yes, it is.
Super. Thank you so much, and we really appreciate you taking the time with us today.
You are welcome. Bye.